I was told that I get to take you into happy hour. So I'll try to keep it brief. I'm Kara. I am an oncology social worker at UC Health at Cherry Creek. I cover all disease sites. I've been there at UC Health for 23 years, and 18 of them have been in oncology, and it is my passion, and I see the beautiful work all of you do every day, and it's really special. So I just wanted for you just to think a minute, maybe close your eyes, if you will. Just go with me today, okay? It's gonna be more fun and breezy, I promise. Not that the rest of the speakers haven't been wonderful, but I'm just gonna lighten it up a little. But I do want you to think about for a moment just how many patients you've touched. How many have you had a thoughtful interaction with? Somebody that you were able to put at ease, make them feel better, make them smile, maybe, make them laugh. You've probably touched a lot of patients, and when I look at the room collectively, that's a lot of people. You've made a difference in their lives. So anyway, thank you for your fine, fine work. What I wanted to do really is just do a really brief run through about wellness. And I'm also a registered yoga teacher, cancer survivor, and I had to learn wellness on my own. And what I wanted to do today is at least give you practical things to do that you can embed in your life that don't mean some major overhaul, because I think that's where we stop taking care of ourselves, is it just seems like one more thing to do. So anyway, given that, I'm just gonna point out a couple things. Wellness, and this definition, the thing that I like about it is it's the first part, the quality or state of being healthy in body and mind, especially as the result of deliberate effort. So it means it's kind of on us, right, to take care of ourselves. You all are probably familiar with a lot of these terms, but these are the three common issues for oncology professionals. We have burnout, and I'm gonna kind of distinctively go through all three. Burnout is more chronic workplace stress that has not been managed, really even institutionally. Compassion fatigue is stress resulting from the desire to aid a traumatized individual. And if you can imagine, all of our patients are experiencing a trauma. It is a trauma to get a cancer diagnosis. And then secondary trauma is a stress resulting from indirect exposure to another's traumatic experience. So think about what you witness and what you walk people through. And there are lots of risk factors, and I'm just gonna breeze over this, things that impact our risk for those common issues, how the workplace manages their employees and how they support you, cultural issues, financial, socioeconomic, turnover, which we see often in healthcare, and then finding sense of meaning and responsibility in our work. And then finally, your social support. So just because you're nurses, I threw in a little bit of studies. There's a lot of references in the back, but in the studies that I found in oncology, nursing, and burnout, nurses present higher levels of emotional exhaustion and reduced personal accomplishment. They have lower levels of compassion satisfaction, meaning it's sometimes we're tired of patients. We don't want to help them, or we're worn out with them. increased burnout and increased risk of burnout and compassion fatigue. And then burnout increases with workload demands and time allocated to provide person-centered care. So the effects of untreated burnout, compassion fatigue, and secondary trauma are physical, mental, and emotional exhaustion, relationship difficulties inside and outside of the workplace, indifference towards patients and their suffering, and taking on suffering of others, and difficulty setting boundaries. So keep those things in mind. So the things that I really wanted to do with you today are focus on the simple wellness tools just for integrating into daily use. Oh, I should have gone back. Whoops, how do I do that? Okay, so physical activity. Virginia Borges, you might know her, she's our young breast cancer guru, came to speak to my breast cancer support group, and she said, somebody asked her, well, what's the best way to prevent cancer? And she said, number one, hands down, exercise. You all probably know that, but do we really make time for it? And then mindfulness, meditation, and breath work are the two main tools that help us move from getting out of the stress response into that higher part of our brain where we have more problem-solving capability, able to calm ourselves and reason and be able to slow down. So, okay. So I'm just going to walk you through some of these tools, and hopefully they're going to have this presentation to tap into. And I'm going to pick a couple in each category for us to just do a little short practice with. So mindfulness and meditation, how many of you have some practice, regular practice of it? Okay, there's a few of you, great. And then how many of you have dabbled in it and you're like, this isn't for me? Okay. So the thing about mindfulness and meditation is it relaxes and settles down the nervous system. And like my nervous system, as you can tell in my voice, is a little revved up. So there isn't enough breathing right now that helps me do public speaking any easier. But anyway, but it does engage the wise mind. So it can move us from reactivity to that higher part of our functioning and settles. That's when the parasympathetic nervous system kind of goes into play. So daily intention setting. So this is a thing I actually do for myself, but I also ask my patients to do. Ask yourself every morning, just this 5-minute check-in, what do I need, what do I prefer, and what is something that would bring me some enjoyment? And just to remember, we are the architect of our lives. We really are. And so by thinking through what is on my plate that I could put on this day, what are things that I can do to insert some joy in a day that seems hard or heavy, get that straight with yourself before you walk out the door in the morning, okay? Slowing down our pace. I think when we are on fast forward, we don't take time to reflect on what we're up to. Have you ever seen somebody like racing down the street and they're just like, and they're not anywhere but other internally in themselves? That's sometimes where our nervous system can get cranked up. So just by slowing down how you walk through the hospital, noticing people around you while you're walking down the hall, those are all mindful experiences and ways to settle ourselves. Single task your responsibilities at work. Don't try to do it all, which we do all the time and sometimes have to. But how do we that's part of the slowing down process. So our work becomes a little more thoughtful. We feel we do it well, okay? Then, and I'm gonna give you some apps and things, just doing mini body scans, even at night, before you go to bed, just to get some body awareness, to notice where you carry stress internally. And then if you all have smartwatches, they all have a mindfulness app. You can set that and really just take a break in that moment if you can't get back to it. Okay, so physical activity, cardio, even at work, it's so good to do just a brisk walk, even around the block, outside in this beautiful weather, jumping jacks in your office, and you can do things like mountain climbers maybe. You know, find a place where you can do things right where you are. Chair squats, so let's get up, and if your knees will allow you, come on, let's do some air squats. Just, it'll get you moving. I know it's kind of weird. I'm in a dress. I'm gonna do them with you, okay? So only if your knees allow. Has anybody not done an air squat? Maybe a few of you. So all you're doing is just coming down into a squat and lifting up, okay? And if your knees don't want you to do it, you don't have to do it, okay? Maybe 10, yeah, 4, yeah, there you go. See, everybody's laughing. Yeah, okay, doesn't that feel good? Yes, right? Woo, all right. See? That feels pretty good, right? Not too bad. I'm also, thank you all for doing that. So you can keep standing, or if you want to sit down, I'm going to just teach you a nice little yoga pose called the eagle arms. This is awesome at your desk because it stretches out your back and your arms, and you'll feel like a new person. But what I want you to do is I want you to put your arms up in front of you, and you're gonna cross your right elbow over the left elbow, and you can stay here, okay? Or if you have a little more room, you could grab your hands. And what I want you to do is just push the elbows away from your body and lift. And just notice how that feels. And you can play with that as much as you want. If it hurts, you just stay here and be okay with where you are. That's all part of yoga. It's not a competition. It's just where can you get a little stretch, okay? And then we're gonna do the other side. So cross opposite elbows. Again, push away and then lift up. Wherever that is for you. And when you release, just notice how your arms feel. Does that feel good? Yeah, it does. It feels good. Also, you can do like hip openers in your chair where you cross the ankle over the knee, okay, while you're sitting down. You may not be able to get very far, it's okay, but that can open up your hips on both sides. It's amazing. And we hold a lot of our baggage, actually, in our hips. So hip openers are great. And then also, even just standing up, I want you all to try this. One more time, stand up. We're just gonna do one balancing pose. Now, I know you think everybody's like, oh no, my gosh. You've got each other to catch each other if something happens. All I want you to do is I want you to bring your right foot in front of your left, and I want you to push your thighs towards each other and lift up from your top of your head. And maybe you want to bring your hands down. Your gaze, if it's on the floor, gives you a little more stability. Okay? And then you need to always do the other side. Okay, so you can switch it out and just keep pushing your feet into the floor and bringing your thighs towards one another, okay? And that just can ground you instantly in the middle of the day, okay? So these are easy. These don't take long, right? Okay, what time is it? It's almost happy hour. We're almost there. Okay, so also breath work. Oh wait, did I miss something on the other slide that I wanted to say? Oh no, okay, we're good. So breath work, again, like mindfulness exercises, can take you from stress and your sympathetic nervous system on overdrive to calming the nervous system down, okay? So these are just a few ideas. One thing I do before I go into a meeting when I'm rushing around at the hospital is before I walk in the door, I take 3 full breaths. And it just helps me leave whatever activity or whoever I was spending time with, and it kind of is this little transition to be more present in the meeting or with my patient. Super easy, right? Like, not hard. And it's good, like it lets us say, I'm calm. Also practicing elongating your breath. So inhaling for 5 counts, exhaling for 8. Inhaling for 5, exhaling for 8. And you do that activity until you feel your nervous system come down. Okay? So you know that these exercises work when your nervous system settles down. Okay? And if it isn't after 5 minutes, then you need to maybe do it for 10. Okay? You just need to do it until you feel yourself physically calm down. Okay? There's also you can find all sorts of crazy breathing exercises online, but also the box breath where you inhale for 4 counts, hold the breath for 4, breath retention for 4, then exhale for 4, hold and retain for 4. And you do that until you feel settled, okay? And then also breathing through a straw. If you get your big gulp, like for lunch, you can use that straw. Save your straw. And you can breathe in and out of a straw. It's like pursing your lips. It's a really good breath exercise for getting you down quick, okay? And it all improves sleep and all those fun things. Okay, we're almost done. Here's my resource list. This is fun. Insight Timer, do any of you know that app? It's free on your phone. It says you can upgrade. You don't have to upgrade. They've got like over 100,000 guided meditations. You can put it in for your love life, for healing, for sleep, for anxiety, for depression, anything you need. They've got a guided meditation for it. And you can even start 5 minutes. If this is new to you, just 5 little minutes a day, or even once a week. It's hard to get going, it will give you the most beautiful mental vacation you've ever had. And it's a cool app. It shows you who else is using that app around the world. It's really awesome. And it's free. Also, Yoga with Adrienne. You could do this in your home. She's lovely. She's got 20-minute classes to an hour for every body, every person. And so that's excellent. If you have trouble with sleep, has anybody heard of Nothing Much Happens for sleep? Oh my gosh, okay, so you got to check this out. It's, the woman is a yogi, but she's actually a writer, and she writes adult bedtime stories. And she's got a website, and she's also on Spotify and some other apps. She reads through a beautiful story, like just in fine, fine detail, like I'm walking down the cobblestone path. There's fog, there's a wrought iron fence, where nothing happens in her stories. And so it's 15 minutes long, and then she reads it through a second time slower. And it's amazing, and patients are finding it super helpful too. And then there's other apps like Calm, Headspace. Some of those cost money. There's a mindfulness coach. I've never used this. I got that from one of our psychologists. Better Me, and then Couch to 5K. If you're not used to moving your body a lot or don't make time for it, it's kind of a fun app. It does cost something, but you don't necessarily have to run a 5K, but you could walk one. So anyway, those are those. And then here's all of my great research for you nurses. Okay, and that's it. Yeah, thank you. Thank you all.